The other big story, of course, that we continue to talk about, another coronavirus update. There are growing concerns this morning as the state of California has declared a state of emergency. California reported the first death from coronavirus outside Washington state. This was a man who first got sick on a cruise ship. That ship is now being held off the California coast until they can screen everyone. Meanwhile, officials in King County, Washington, that of course includes Seattle and tech giants like Amazon, Facebook, Microsoft, they're asking anyone who can work from home to stay at home and work from home. Major airlines, including United, JetBlue, they're announcing plans to cut flights inside the U.S. and internationally in response to the outbreak. There was an airline in Great Britain that folded this morning, according to Tom Costello, due in part to the coronavirus outbreak.
Talked to somebody who was in Logan yesterday, and they said it was totally quiet. There was nobody there. I think people are terrified, right? They're like, should I get on a plane? Should I not? Everybody on the plane is wiping the plane down. People in hotels like myself, what can you touch? What should you not touch? I mean, I think there's and then everybody says, just kind of, relax, go about your day normally. And we're all here saying, state of emergency. So it's,
Let's bring in
challenging.
Let's bring in Dr. Natalie, NBC News medical contributor, Dr. Natalie Azar.
There she comes.
She's become our coronavirus expert.
Yes.
And you know what? It's because we have these staff meetings, and it's all that any of the staff wants to talk about. So we actually had some producers in the editorial meeting who had questions, and they thought, well, this actually might make for a good segment. Let's ask our questions, because these are obviously the same questions that folks watching and listening have.
Absolutely.
Our senior producer, Cecilia Fang, she's up first.
Hi, Dr. Azar. I live in a multi-generational household with ages ranging from 9 to 75. If one of us gets sick, how do I make sure everyone else stays healthy?
Okay, so CDC actually has guidance on this. This is something that I think we may all experience at some point. The number one thing to do is to designate an area in the house for that sick person. So someone who has coronavirus in your household, ideally they're in a room all to themselves.
You quarantine them.
Basically. And quarantine, by the way, is for people who aren't sick but might have been exposed. This is called isolation, okay, when it's a sick person. You want one person, ideally, to be taking care of that person who will be going in and out, not multiple people in the household.
Wow.
It's incredibly important that the person going in and out either wear gloves, and as soon as they take them off, wash hands going in, wash hands going out, use hand sanitizer on the way in, use hand sanitizer on the way out.
So just like a hospital.
Basically, you're creating a bit of a hospital, what we would do in the hospital, and that have the minimum number of healthcare workers treating a patient. You want to have the minimum number of household members in contact with that person. And, we did in the 8, Dr. John did a great segment on disinfecting. That's incredibly important. Door handles, sinks, knobs, remotes, anything that could come into contact with the person going in and out, let's say.
Is that person, Dr. Azar, who thinks they may have coronavirus should not just go to the hospital? Or you're saying isolate them in your house?
You can isolate them in your house. And, guidance may change on this, but if you're well enough to be taken care of at home, and there are many people who are younger, otherwise healthy, you don't need hospital care for this. It's actually better not to go to the hospital because you're exposing other patients and healthcare workers, and you just may not need that degree of medical care.
But you don't want to, like if someone has the flu and not the coronavirus, so you don't want to isolate them.
We don't isolate flu. We've become very complacent about flu, but I think this, we know it's more contagious than the flu, and so I think this is, as this evolves, I think we're saying isolate those folks.
Our next question comes from another one of our producers. This is Kate Ubergan.
Hi, Dr. Azar. So what happens if all the disinfectant wipes are sold out at my local store? Do I just crack open the liquor cabinet?
Okay, so I love this question. And by the way, my colleague just texted me this morning, and she's like, here are makeup removers. Stop using your wet ones, because she's like, come to the office. I put anything on my face before I see my patients. So, yes, they are in short supply, which is really unfortunate. Here, I would say, yes, you can go to today.com, go to CDC. There are multiple EPA-registered disinfectants that you can use. You don't need to just use the hand wipes. They're convenient. You can even make your own diluted bleach solution at home. You take 5 tablespoons of bleach to a gallon gallon of water or 4 teaspoons of bleach to a quart of water, and there you have a disinfectant. You can use that. You don't have to just use the wipes.
Dr. Oz was saying this morning it's all about the fingertips.
Yeah, we got a lot of stuff under the nails and things. So he did a great job of showing how surgeons scrub into the OR. That's basically the kind of vigorous hand washing we should all be doing,
Okay,
which is
so
not
I wasn't
easy.
doing that at
I'm going to
all.
need more.
I think that's one thing. Once we're on the other side of this, that's my big takeaway. I don't think we've been washing our hands
We
very well
haven't been
as a
washing our
society.
hands right.
No, we haven't been scrubbing.
No?
Who's scrubbing
Under
in
your
there?
nails, yeah.
Ew.
Next question. By the way, that was Kate Ubergang. This is Amanda Avery, our
touched me?
supervising producer.
Hey, Dr. Azar. So I have a vacation booked next month, and I really want to go on it. So is there anything I can be doing now to help boost my immunity and keep myself healthy?
Okay, so I think here, I wish I could give you this magic bullet on immune boosters, but I think regular stuff applies here. You're washing your hands all the time. You're paying close attention to your diet. You know, there's a lot of immune-boosting medicines, fruits and vegetables out there. Hand sanitizing, all of that stuff, sleep and stress. I will make a comment about air travel, because that's a question that I'm certainly getting a lot. Is the air cabin conducive to transmitting contagious diseases? Well, happily, many airplanes are actually equipped with these filters. They're called HEPA filters. They're actually hospital and operating room grade filters that filter circulated air 20 to 30 times an hour and can really remove almost like 99-point-something% of particulate matter.
That's good.
I wasn't even aware of that.
Did not know
So
that either.
I think the biggest concern about travel that I've been telling people is not so much that you might get sick on the airplane. You may get stuck in a place where you've traveled, right? If you've been exposed someplace, you may be in quarantine for 2 weeks, and you need to take that into account. If you have children or work, you may not be able to come home right away.
Real quickly, finally, zinc tablets. People have told me zinc tablets.
I mean, look, I think zinc and emergency C and things like that. These things are antioxidants and anti-inflammatories, but I would not say at all that they would prevent against this coronavirus. Maybe they can do a little to boost your immune system in general, but I wouldn't bank on just that, Maria. Wash your hands.
Okay, scrub my finger.
Wash your hands, Maria.
I'm going to wash my hands and I'm going to scrub. I'm going to go get one of those.
We've got some. I know we've got some of that hand sanitizer around here, so we've been really good.
Yes,
about that.
good.
Dr. Nelly, thank you. We learned a lot.
You're welcome.
We learned a whole
Thank
heck of
you.
a lot from you.